On a recent day in downtown San Diego, the Father Joe's Village's street health team gets ready to head out in their van, nicknamed Florence Nightingale, to check in with their homeless clients.
That area is typically which team will send out where. I know that my team is out there doing good work and helping people connect the dots to get the care they need.
Monday through Friday, twice a day, Supervisor Jennifer Wilkins and her team work on building relationships with the homeless community by showing up and following through with the goal of getting them into shelter.
When they tell up, Michelle, hey, I'm considering getting into shelter. Can you tell me what that looks like? What are my options? That's success. When we start having those meaningful conversations about what they can do to start making some progress, that's success.
You wouldn't know it by looking at them, but both Wilkins and her street health teammate, Michelle Lefevre, overcame addiction themselves. Also formerly homeless, Lefevre says her outreach work is a way of living amends for her past.
I understand my clients. Like, I've been where they've been. I understand what it means to that need to hide the pain, use, substances as a solution. I get all that. But now also what I get that there is like life after that if you work hard for it. And I think that's what makes me bond with my clients.
According to the San Diego District Attorney's Office, homeless San Diegans are 118 times more likely than the general population to die of a drug overdose. Each member of the team carries a backpack. One has medical supplies as well as Narcan and other medications to reverse overdoses. Another carries more basic necessities, which they call tools of engagement.
When walking up to people, they look at us and they're just like, don't bother me, right? But how does that look if I walk up, carrying a water and a snack? So sometimes this could be we want them to get their COVID shots. But this could mean whether or not they stick their head outside the tent or whether they just like go.
Those tools and connections go a long way. They can eventually lead clients to reveal personal information that makes it easier for the team to follow up and track their progress.
So that we can get people registered and into the system so that we can document on them later.
Father Joe's psychiatrist, Dr. Safia Med, says many unsheltered residents have anxiety, depression, and likely experienced some form of trauma. He credits the team's ability to break down barriers.
They're the hero for building those connections. That's probably the biggest issue, trust and building that rapport. Some of these people have been really hurt and abused their whole lives, and trust is hard to build, and so the outreach team does that. Once that's built, that's when I come in.
We're getting a little backstory.
In the last year, the team has helped move about 20 people into permanent housing and almost 60 into shelters, but thousands more still live on the street. And with the city's new unsafe camping ordinance, the team says it's made their job more difficult.
This is supposed to be a solution to help, not to hinder. And when clients are actually willing to receive that help, and that's not the first thing that's being offered, it's heart-wrenching. And so for us as a street health team, it's been hard to find our clients. It's been hard to find our patients.
When asked for a response to this, a City of San Diego spokesperson said in part, the goal of the unsafe camping ordinance is to communicate that our sidewalks are not an acceptable place to live, and to encourage unhoused people to work with their case managers to get on a path to end their homelessness. We're seeing success on that front. Seeing the homeless crisis on an intimate level day after day, the street outreach team says the first step to solving homelessness is getting more boots on the ground to build that trust and ultimately move people off the street and into housing. Melissa Mae, KPBS News.